Thank you, Leo, for the introductions, and thank you, Paige, very much for the overview of the World Hearing Report and how much it says to us and the opportunities that it gives us to move on. As coordinator of CIICA, I'm delighted to be here and to share what the World Report on Hearing tells us and the implications, the evidence for our cochlear implant advocacy. It's a long report with much to say, and it's very helpful to be able to have a closer look at it. Now, in spite of the World Report on Hearing saying cochlear implant is one of the most successful of all neural prostheses developed to date, that was page 100, there's still much to do about advocacy for cochlear implants. The report makes clear that deafness and hearing loss is a challenging global health and social issue that needs to be tackled. And for the first time, here we have a report from the World Health Organization, which actually talks about the huge impact of hearing loss on children, adults, family, and society. And if we don't address it, how it impacts negatively on just many aspects of our lives. The report also recognizes the benefits of today's technology, specifically including cochlear implants, recognizing them as part of ear and hearing care right across the life course. For example, cochlear implants are electronic devices especially useful when a conventional hearing aid has little or no benefit. And here we have, in adults, the use of hearing aids and cochlear implants. In children, timely intervention with hearing aids and implants. And the report asks us to improve access to high-quality, affordable technologies such as hearing aids and cochlear implants. So here we have cochlear implants included. And the economic case for cochlear implants has also been made. We heard from Paige about how unaddressed hearing loss imposes a global cost of more than 980 billion annually. And the cost of doing nothing about this is not one we can afford. The World Health Organization shows us that for every dollar invested in cochlear implants, there's a return in both high-income countries and in low and middle-income countries. That cochlear implants are cost-effective as well as being effective. And in the report, the case for adult screening and newborn hearing screening are both made, and that's really important to us all if we're to be able to provide hearing aids or cochlear implants in a timely fashion. And the World Report on Hearing actually recommends hearing screening in newborns, active hearing screening services for older adults, and that the economic case has already been made for both of them. It also talks about rehabilitation, and there's lots of debate about rehabilitation and what we should call it, particularly in older adults. Whatever we call it, whether we call it lifelong aftercare, lifelong support, lifelong services for cochlear implants, the World Report says that cochlear implantation must only take place where the supportive infrastructure for rehabilitation therapy exists. And as Leo said at the beginning, this was not mentioned in the published paper on the consensus statements. It's emerged as a real priority for our CIICA community, for both adults and for children, the lifelong follow-up care that's needed. We've all learned that surgery is only the beginning, not the end of a cochlear implant service. Another thread going through the report is person-centered care, meaning that people in communities are being viewed as partners in shaping both policy and the services. A shift to thinking about the needs of individuals and families and communities. And the report also talks about the development of user-driven hearing technologies and an integrated life course approach to the support of ear and hearing care provision. So why is cochlear implant advocacy so important? Why is it needed? Why are the goals of CIICA needed today? Stigma is another thread that goes through the report, being associated with hearing loss. And the World Report recommends raising awareness about hearing loss and about what we can do about it with communication campaigns with accessible information and strengthening associations of people with hearing loss And we have many people and organisations with hearing loss listening to us from around the world tonight. And despite WHO recognising cochlear implants as such a successful device, they do note that their take-up has been their take-up's had considerable variation and a lack of take-up by those who could benefit, including in high-income countries. They also remark on limited research and data on access and factors limiting their use. And one of the things that really got CIICA going and formed and stimulated the thinking was the fact that only about 5% of those who could benefit from cochlear implants actually do so. This gap is huge. And one of the things that CIICA was formed to address. So what are we going to do? Well, we've got support for action globally, as you can see on the website. Professor Graham Clark, supporting CIICA action. We've got George Trevigliades from Russia here tonight. Neelam Vaid from Pune isn't here with us, but fully supports everything that's happening in spite of the huge challenges they have in India at the moment. And Patricia Folletti from Argentina, quite ready to translate the new tools that I'm going to talk about for their use in Latin America. Now we're going to hear from Eddie in Uganda in a moment and Beatrice from Italy about what they're going to do with the World Report on Hearing and Advocacy for Cochlear Implants. But first, we've got some new tools to share with you. Summaries of the World Report on Hearing and its implications for cochlear implant advocacy. Ready for you to download, print, translate. Just get in touch with us if you wish to translate them, because they need to have a common message. They need to have a common style, and they need to be translated and then put into the same style and format as all the others, so that we have a growing global campaign using the same evidence and the same messages. Soon we'll have 2 more focused ones, one for adults and one for children. But in the meantime, these are there up on the website and ready for you to download. So please go to ciicanet.org/resources and download them, ready for you in your region or countries to use. So thanks for all your support and joining us tonight for this, and we look forward to further discussion. Thank you.